Hi, this is Dr. Tom McDonagh from Good Therapy SF, and today I'm going to be talking to you about cognitive distortions. So in previous videos, I've talked to you about the importance of thought records, where we look at thoughts, evidence for, evidence against, and we develop a more balanced view. Well, today we're going to be going a little bit deeper into some of those automatic thoughts that I referenced in the thought record video. And there are different types of thoughts that we tend to have based upon the situation. So with cognitive behavioral therapy, we've found that there's about 10 different types of cognitive distortions. Today I'll be talking about two of them in particular because they relate to anxiety pretty well, catastrophizing and future tripping. But before I get into those, why it is important for us to know what cognitive distortions are? Well, it's important because when we're looking at our thoughts, when it comes to anxiety, it's important for us to create a sense of distance from our thoughts. The issue that we always run into in mental health is that we fall into this idea that because we think it, it must be true. Well, it's important to recognize our thoughts sometimes are not always completely accurate, shocker, and as a result, we need to create ways to observe them from a bit of a healthy distance for us to know what's more likely to be adaptable or effective for the situation. So that's why it's important for us to know or recognize the patterns for when these cognitive distortions pop up. So the two that relate to anxiety, like I said before, are catastrophizing and future tripping. So catastrophizing is when we are in a highly anxious situation and we are assuming that the worst case scenario is definitely going to happen in the moment. A good example of this is a panic attack. Often in cases where people are experiencing panic attacks, the issue is that in the moment they believe they're having a heart attack and they're going to die in that exact moment. So they're assuming the worst case scenario. With the case of the other type of cognitive distortion, which is future tripping, it's very similar, except that we are assuming the worst case scenario is definitely going to happen in the future. So an example of this is test taking anxiety. We are assuming that we did not do well on the test, and then we're going to fail the test, and then as a result, it's going to create a domino effect where all these other negative things are going to happen. Often it leads to something like me losing my scholarship or me getting kicked out of school. As a result, my career, my entire future is gone. It's going to be very negative as a result. So it's important to recognize that when these two types of cognitive distortions are happening, be it catastrophizing or future tripping, you want to pause, observe that it's happening, and then you can refer back to the thought record video before to kind of see what to do with it. But at the very least, just recognizing that you're falling into one of these anxiety type of traps, it is very helpful to pause and observe, and then you can kind of think in a more adaptive, more helpful way as a result. So that's just one more skill you'll learn here at Good Therapy SF. Until next time, take care.